Earlier tonight, I told you about a local effort to give newborn babies the best beginning possible in life. The StartStrong project is already making an impact in its pilot neighborhood, Avondale. Here's a look at how it works and one woman who says it has made all the difference for her family.
Happy. Say hi.
Smiles now, but Cecilia Moore will tell you she had a tough pregnancy, all while having to take care of her other children.
Everybody needs me, and I didn't have anybody who I could lean on. So,
until these two came into the picture.
Until them two, yes.
The two VIPs she's talking about, Good Sam nurse Courtney Black.
She just needed somebody to really just push her to be her best self.
No, I really do appreciate that support. I really do.
And certified community health worker April Griffin.
We work from the earliest in the pregnancy until the child is 1 year of age, because we're fighting infant mortality.
That fight takes them from the hospital to the home. They learn what mom or mom-to-be needs, help with everything from keeping the lights on to doctor appointment transportation to housing to food.
There was times where I might have ran out of food, and Miss April would provide me with a Kroger gift card so that I could provide food for my children and my family.
And you.
And me, yeah.
So they say keeping environmental challenges in check helps mom focus on baby. Joining me now to talk more about that is Jill Miller, the president of BI3. It's responsible for an initial grant of $3 million for StartStrong. Thank you, Jill, for being here.
It's my pleasure, Kristen. Thanks for having me.
You bet. So BI3, for people at home who might not know what that is, what is it?
BI3 is Bethesda Inc.'s grants initiative to transform health in Greater Cincinnati.
Okay, why take a look at infant mortality?
We are home to one of some of the leading healthcare systems, yet we have had one of the highest infant mortality rates in the country. And we wanted to do something about this, and we asked the community for ideas.
Okay, and you guys actually brought competitors to the table, which I think is really interesting. Tell me about that.
We did.
Yeah.
So Cincinnati Children's Every Child Succeed, but what's been really neat to watch is watching Dr. Mike Marcotte from TriHealth and Dr. Elizabeth Kelly from UC really come together and collaborate around how to put mom at the center of care and provide her what she needs instead of making assumptions.
And it means going out into the community and building trust in part, correct?
It does. It means starting with mom and talking to her about what she needs. It's going beyond the clinical walls and into the community to address barriers and, you know, surrounding her with whatever she needs.
Why Avondale?
Avondale, at the start of the project in 2013, it had one of the highest infant mortality rates in the country.
Wow.
And today, it has a lower rate than Hamilton County as a whole, which is a striking accomplishment.
Yeah. So what does that mean for StartStrong, the program, here in Ohio and perhaps other places?
We're already attracting state and national attention. Doctors Mike Marcotte from TriHealth and Rob Kahn from Cincinnati Children presented at an international conference recently. And after they shared StartStrong, they had a number of physicians and public health leaders come up and ask them, how do we take this back with us and do something similar?
Okay, so it's not going to stop with Avondale. It's going to spread.
Yeah, we're just getting started. We're talking with Cradle Cincinnati right now, how we take it from Avondale to 3 other communities here in Cincinnati. So, but one thing we know for sure is we're going to start in each community by talking with mom.
All to have healthier babies.
Absolutely.
Jill, thanks for being here.
Thanks, Kristen.
You bet.